Chapter 3. We can sense. Sense organs are the specialized organs which help in our ability to perceive our environment. They play a crucial role in how we live and how they give us the only ability to sense our surroundings. As a result of a specific physical phenomenon, sense organs supply the necessary information for interpretation via numerous organs and a network of nerves. These senses control how we relate to and engage with the environment. We have 5 sense organs, namely, eyes, ears, nose, tongue, and skin. These 5 sense organs have receptors that send information to the areas of the nervous system via the sensory neurons. The receptors can be divided into 2 groups: general receptors and particular receptors. 5 senses: sight, smell, touch, taste, hearing. Let us learn about the sense of sight, sense of sound, sense of taste, sense of smell and sense of touch. Sight. Eyes. These are the visual sensory organs in our body. These are sensitive to light images. The eyes vary in color depending upon the amount of melanin present in our body. It helps in the sense of sight by detecting and focusing on the light images. Hearing. Ears. The auditory sensation is provided by our body through the ears. They support our ability to hear. We can hear sounds because of the way our auditory system picks up air vibrations. The terms hearing and audio caption both refer to this. The 3 portions of the ears are the inner ear, the middle ear, and the outer ear. Taste. Tongue. The tongue helps in the perception of distinct flavors and tastes. On the tongue, the taste buds are situated between the papillae and aid in the perception of various flavors. Taste and smell are 2 senses that frequently cooperate. A person cannot taste anything if he could not smell it. The word gustoception is another name for the taste sense. Smell. Nose. Nose is our sense of smell, olfactory organ. We can detect various smells through our olfactory system. Our perception of taste benefits from this sense organ as well. Olfaction, or the sense of smell, is another name for it. Touch. Skin. Skin is the largest organ of our body. It is related to the sense of touch. The sense of touch is also referred to as tactioception. The skin contains general receptors which can detect touch, pain, pressure and temperature. They are present throughout the skin. Skin receptors generate an impulse and when activated, is carried to the spinal cord and then to the brain. Ways to communicate with hearing-impaired people. Hearing-impaired people may not be able to hear what you are saying, but that does not mean they cannot understand you. Especially if they use lip reading as a way to interpret conversations. Hearing-impaired people have 2 main ways of communicating with others: lip reading and sign language. Let's learn more about these 2 forms of communication. Lip reading. Lip reading is a technique primarily used by deaf people or those who have some form of hearing impairment. Lip reading, also known as speech reading, is a technique of understanding speech by visually interpreting the movements of the lips, face and tongue when normal sound is not available. Lip reading can help people who are hearing impaired to cope better with their hearing loss. Sign language. Sign language is a visual language that utilizes hand gestures, facial expressions, and body movements to communicate. Sign language has been shown to have numerous benefits for individuals who are hard of hearing, including enhanced cognitive development, improved social skills and increased access to information and communication. Sign language alphabet.